All right, people, welcome back to One Body, episode 5.
Wow.
I'm Kruesi.
I'm Eden.
Today we're talking about Health Maintenance 101. Oh yeah, it sounds so fun, doesn't it? Basically, today we are talking about going to get your regular checkups, what that means, what kind of checkups you should be getting depending on your age, what kind of health screenings you should be doing, and just preventative medicine in general. Because sometimes I think we forget, like, oh, when I turn this age, this is when I start doing X. So,
Or if you're like me and I'm like, wait, I'm 26. Okay. I used to get a physical for soccer in high school and now
haven't had one
haven't done
since.
that yet.
Wait, have you actually not gotten a
Never
physical?
done that.
Never.
I mean, I went to the gynecologist. That's all I've done since.
Oh my gosh. See, this is why we're doing this.
Yeah. Okay.
Bad patient. Okay, rapid fire questions to start us out. What is your current coffee order? If you're okay with spending $9 on a coffee, what do you get?
Oh my gosh.
I mean, that's what it is. Come to
Okay.
Atlanta.
Yeah, I moved to Chattanooga. Oat milk latte with honey.
Oat milk.
Womp womp. Yeah, because unless I'm home, then I'll get lactose free, like regular milk.
Okay. Dang it. I should have gotten... Eden's coming over to my house. I don't have any lactose-free milk.
Oh, I mean, I'll survive. It's
I'll
worth
just
it.
be farting all day.
Okay. I'm not sleeping in your bed, so.
Oh, that's funny. Okay, mine is a iced
Oh.
latte with honey. Actually, if you come to Atlanta, but with whole milk, come on, it's so different. If you come to Atlanta, anybody, you have to go to Bellwood Coffee. Okay.
Okay.
You have to get half cold brew, half Ezra. Shout out Katie Johnson for telling me.
What's Ezra?
Ezra, it's their own term. It has horchata in it. It's like cold brew with horchata, which is like a rice. It's like a sweetened rice
You
syrup.
say the H.
What do you say?
Horchata?
Oh, sorry.
I don't know.
It's a cold brew with horchata.
Yeah, okay.
That's like when people say, yeah, can I get a croissant?
I knew you were saying
And you're
that.
like, can you get out?
I
You do not live in
coffee and
France.
a pain au chocolat.
A pain au chocolat. Okay, we're not being very rapid. What's
Okay.
your favorite treat or like dessert at the moment?
I mean, I love a pain au chocolat. What can I say?
my gosh.
but,
Yeah.
but last night I did make Nutella crepes with strawberries, and I mean,
What the heck? You made them?
yeah.
You have a crepe maker?
No, it's just like a batter, and you put it on a skillet.
Wow, we should do that today.
What would you say?
My favorite treat, hands down, always and forever till the day I die, chocolate chip cookie.
It's this. I don't know why we're doing that.
Did you already do that
This whole
today?
session is this.
I hate it. Edit it out.
Wait, what did you say?
A chocolate chip cookie. Can't get better.
Oh, okay.
Is that boring?
I'd prefer snickerdoodle.
Ugh.
Soft, chewy.
Honestly, when people say like any other dessert besides a perfectly made chocolate chip cookie is like if someone says something is better than that, I actually kind of like change my opinion on that person.
Okay, that's my
I know. That's
like
what
warm
I'm
fruit beats a warm fruit dessert such as
warm fruit.
such as a cobbler, which is what we're making tonight.
Okay.
Fortunately.
Cobbler. You honestly think a cobbler
Yes.
that is warm fruit is better than a perfectly chunky,
Yes.
crisp on the outside,
Yeah.
gooey in the middle chocolate chip cookie?
Yeah, and if I'm eating a chocolate chip cookie, I want it to be room temperature because I don't like when the chocolate's I want the chocolate to
I
be
kind of
slightly
agree
hardened.
with you. I agree with you
Okay,
there. Okay. Anyway, agree to disagree. What's the last TV show you watched? You can't lie.
We watched DCC, Dallas Cowboy.
Yes, it's actually not called
Cheerleaders.
that. I call it that too.
It's called
America's
America's
Sweethearts.
Yeah.
That was so good.
was
I loved
so
it. I cried.
Cried and laughed and
Cried of joy.
yeah.
I watched So Embarrassing, The Summer I Turned Pretty, season 3. I've watched 3 seasons.
That's pretty bad.
And it really hooked me this last one. I won't say
Really?
in case someone's caught up, but I was like, yeah.
Okay, I will say I'm rewatching The Perfect Couple. Did you watch? Because you should.
Oh, that it's kind of a weird vibe.
The murder mystery.
It
It's
like
like a
put
murder
me in a
mystery.
weird mood
That's fair.
when I would watch an episode.
I just like the everything.
Yeah.
na, na, na,
Yeah,
na,
good.
na.
No, it's kind of weird. I also don't really like that actress. Sorry. She's
Oh, I actually
annoying.
loved her, but I didn't
Oh.
like the girl that died.
Yeah, she's annoying. What book are you reading currently?
Golly, it's like the titles. I am reading a
can't
book.
remember.
It's called Better Than the Movies. It sounds
Oh,
cheesy. It was
okay.
recommended by my cousin who is a hopeless romantic.
It's
It's like a
beach read.
teenage like rom.
Yeah.
It's good. I mean, I'm actually pretty hooked, but it's kind of silly.
Did you ever read
Yes.
Iron Flame and all that?
Fourth
Wing?
I listened to Fourth Wing
Oh.
and didn't make it past, but I think if I had read it, I would have enjoyed it more.
Yeah, you should try it. That was, I mean, I can't, it's like kind of soft porn, but it was the first.
That's why listening to it, I think, was very
That's hard.
strange.
Because then someone could walk up and you're like,
I'm like
"What?"
cooking. I'm like, golly. And she's like, what are you? I'm like, I don't know.
Yeah, I think you have to read it like on your own.
Okay.
Yeah.
Okay.
This storyline is so captivating. I really loved it.
I'll try it again.
I'm reading a very riveting book called A New Earth. It's by Eckhart Tolle. It's actually so good. My mom and my mother-in-law both recommended it. It's about like basically the ego and the ego being your thoughts and how they can kind of take over your whole life and become your whole individual person, but they're not actually you. Your thoughts are separate from your true being. And so it's talking about how to be aware of the ego and aware of your thoughts and how in your emotions and how you're responding to things and how much that can help you. So
Cool.
I really like that one if you're into kind of like self-help or like spiritual books. Last thing that made you mad.
Okay. Last night, my husband, like on Friday night, I'm always getting this urge to do something fun. It's Friday
I thought you
night.
were going to make urge to...
Sorry, let me restart. Friday night, I'm always like checking my phone, like, all right, what are we getting into?
Yeah.
Like, come on, Richard, what's going
Friday
on?
night.
And for some reason, Friday, like, he's the worst at like texting me back Friday, and I'm like, do I stay like downtown? Is he gonna meet me somewhere? Should I come home? Like, what are we
Are
doing?
you bringing
I'm
me
like,
a drink on the beach?
yeah, like
or
what am I waiting for? So then I get home, I'm on the phone with a friend. I text him like, should I start dinner? Are we going out? Because I'm getting kind of hungry at this point.
Yeah.
Not responding. Like 40 minutes later on this phone call, I'm like, I should probably go inside. He's on his phone. He's sitting on his phone on the couch. I'm like, what are you doing? He's like, what? I'm like, did you not get my text? He's like, I didn't. I'm like, you're on your phone.
Oh my gosh.
He's like, I didn't see it.
Richmond, we love you.
I love him. Yeah. And then he's like, I'm like, well, I just didn't know if I should start dinner because I'm really hungry. He's like, oh, I already ate. I'm like,
No!
oh my
gosh, we've been through that. Yeah.
Yeah. So it was, I think we had a good solution. I was like, just so you know, Fridays, I really want to know if you have any hopes for the night.
Yeah.
And I don't even need to do anything.
You need the
but I'm always like
expectation.
waiting around if we're going to make a plan.
Yeah.
And then I'm mad, but I hadn't told him that I'm usually waiting around. So
That-
it was just the communication, you know?
That's the key to marriage is telling them. I mean, LOL, I'm talking like I know. I'm 30 years old. That's the key, in my opinion, to our relationship getting better is telling them what's on your mind. Telling them what you want.
Yes.
Just tell them. They don't know what you want.
And I did. I walked in, I said, what are you doing?
Yeah. And now he's like, oh, shoot.
And then 5 minutes later, I wasn't mad.
Yeah. 'cause-
But if I hadn't said anything, I would have been mad the whole night.
Yes, you would have been ruminating on it. That was that's my thing that I was working on last time we recorded because they don't know. And
Yeah.
like, it's a different story if they know and you've told them very clearly, please do this or please don't do this.
Yeah.
And here's why. And it's not totally unrealistic. It's a different story if they know and they're still doing whatever. But if they don't know, like, you can't blame them.
Yeah.
I mean,
It's just a waste of energy to
Yeah.
be mad. Yeah.
yeah. Okay.
What's your
So that made you mad. The last thing that made me mad was I chipped a nail last night and my nails were so perfect. I've kept them natural for a while and I've been just trying to like shape them nicely and they were so ideal. And then I was doing too much. That's the next thing I'm working on is doing less. Yeah.
Why am I throwing my hands around?
Literally running into
Smacking
everything.
them
I
on the door.
have
I'm like,
10 bags in my hand. I'm slipping. I'm holding Palmer and I chip a nail and I'm like, dang it.
Yeah. How did this happen?
Yeah. How did that happen? So I need to slow down. What's your favorite thing about your personality?
Oh my gosh. Well, I didn't know I did this, but apparently I'm like, I like
Our
laugh at
sister-in-law
everything.
said that. Yeah.
I'm
You like that about yourself.
Well, I didn't like how it was portrayed, meaning I was like, that's really annoying. But then I thought, I'd like to be a person that laughs more
Yes.
than is negative. So
You're the kind of person who, if you think you have something funny to say, you should say it to Eden because she'll think it's funny.
I feel
That's
like I'm
great.
quick to laugh and it's not like disingenuous.
No,
Okay.
I agree. My favorite thing about my personality, sometimes I ask Ethan this question.
What do you love about me?
What do you love about me?
If I were a color,
do
what
you
color
love
would I be?
this part of me? He's like, yeah. And I'm like, tell me more. Fishing. I like that I am a go-getter. If I get clear on something that I think is meaningful and that I care about and I think I'm designed for, I'm like, I'm going to do it. I'm going to do it and I can get things done. And I like that about
I
myself.
second that. You are a good initiator.
Yeah.
Like, it doesn't take much to get you going. Like, you can just
true.
step into action.
It's true.
It's good.
Watch out, people. Okay, last question. This is funny because this came up without even you knowing. When's the last time you had your labs drawn, like your blood work?
I've never done that.
But you have to have had done it maybe for a sports physical. Never? Eden, haven't you?
I got a finger prick before.
You've never gotten your vein?
Never. I've
Oh
gotten
my
an
gosh.
IV, like I was put under. Well, that was in my hand.
And after your bachelorette weekend?
Aha, I have gotten an IV.
IV.
Oh, wait.
But that's different than a blood draw. That's wild. Okay,
I should do that.
1,000 trillion%. We should probably do that by the end of the year. That should be your goal.
You're saying by the end of the day.
Let's go. We're done. Okay, so today we're talking about health maintenance. So a part of that is getting your labs drawn as well. I'm asking. Getting your labs drawn is so helpful because it is a unbiased, completely objective view of what your body's doing. So
Okay.
it can tell you so much about your health. So I love getting my labs drawn. It's like you learn so much about yourself. Okay, so these guidelines are coming from the U.S. Preventive Service Task Force mostly. So they make recommendations on how often we should be doing things. So the first thing that everyone should do as adults once a year is get an annual physical, which is your preventative care exam. It's your annual visit with your primary care provider, which is also called your general practitioner, your PCP or your GP, or your family medicine doctor.
But
Those
how
are all
does
the
one
same.
obtain a PCP? You just say, hey, can you be my doctor?
Yes.
Like,
Yeah. You just Google family medicine or primary care provider in your area. I like to look at the reviews of providers. I look, as long as they have a lot of reviews, if there's like common trends, then you can assume they're
See if they take
somewhat
your
accurate.
insurance.
See if they take your insurance. Sometimes you can just get a vibe for them. They usually have a bio. And then, you just make an appointment. Your insurance covers a physical every year, which includes a physical exam. So they should look at you pretty thoroughly head to toe.
Okay.
They should be looking for any abnormal findings anywhere on your body. They should be doing a thorough assessment of symptoms, making sure you're not having any worrisome symptoms. They'll take your vital signs, so they'll check your blood pressure, your heart rate, your oxygen status. They'll check your temperature. They'll calculate your BMI sometimes, which BMI is a really crappy marker.
Womp womp.
Yeah, but still, just making sure like your weight is in a healthy range. You're not too depleted,
What do you say?
too
Too
round.
concave, too convex.
Oh, I like
Somewhere
that.
in the
Okay.
middle.
Yeah, somewhere in the middle. Don't be convex, They should also do a mental health screen to make sure you're not dealing with a lot of anxiety, depression, suicidal ideation, anything like that. And then they should talk to you about your lifestyle habits and make sure you're doing preventative care for yourself. So exercising, sleeping well, eating well, avoiding too much alcohol or substance use. And then my favorite part is they check your blood work. Now, the blood work that they check in your annual physical at a general practitioner's office is very basic, but it's still a helpful screening for like common diseases or issues with your body. So they check a CBC, which is a complete blood count. That's your red, white blood cells and your platelets, making sure those are all in the normal range for your age and sex. They check your complete metabolic panel, a CMP. So that's checking your kidney function, your liver function, your electrolytes. They check a lipid panel, which is your cholesterol, making sure that's in range. They will check a hemoglobin A1C, which is a screening test for diabetes. So that's like an average of the past 3 months or so of what your blood glucose has been. So if it's been really high, your A1C will be high, and that's not good. Sometimes they'll check a vitamin D. Typically, that's only covered with insurance if you've had a history of deficiency there. And then they'll typically also check a TSH, which is your thyroid stimulating hormone, to make sure you don't have thyroid disease. So it sounds like a lot. It's actually a very, very basic lab draw. It's like 2 vials. They stick a tiny little butterfly needle into your vein for like 10 seconds. They draw a few vials of blood and then they send it off to the lab.
I've never done that.
That's blowing my mind. Okay. When you go to your annual physical, the purpose is to ensure you're having good lifestyle, you're preventing disease, and then you're catching any disease early, and you're ensuring that you're getting like your cancer screenings on time. And if you need immunizations or vaccinations, that's what you do. You can get them there too. This is once a year. And if you need follow-ups or if you're sick in between, then you go see your primary care doctor more often than that.
Cool.
I think it's really helpful to go into this annual visit with some preparation and really take a minute before you go in to consider, how am I doing with my health and what are the questions I have for my provider? Because they like to just crank these things out, write them down in your phone. Even if you feel annoying or like you're spitting them out really fast, ask your dang questions.
That's what they're there for.
Yes. And like, that's your only time potentially. You're not going to make a whole separate appointment to be like, wait, will you look at this tiny little thing on my arm? You know, so just ask them.
And they're not going to just think to ask you a really specific question. Yeah.
No, especially for someone like you who walks into the office, they're like, this girl's good, she's healthy. But if you have concerns, you want them to look at your tonsil stones, just say. They may not be able to do a full-on assessment of it, but they can tell you, oh, that's totally fine, or make a follow-up, or I'll refer you to someone else. So go in with specific questions. Ask them what labs they're drawing, and if you have specific labs that you really want added on, ask them for it. If they do not agree that it's necessary, if they think it's just an added cost and you don't need it, that's respectable for them to say, but you also could find another provider who's more open to testing things for you that aren't just those basic lab panels. And then always ask about your screenings. Like, am I due for any health screenings for cancer or whatever? And then if you have any concerns about family history or family genetics that you want to be tested for, you can also ask there. And then you could also bring up like your nutrition, the supplements you're taking, and make sure that they agree with that.
Are they looking like at your skin?
Not like a dermatologist would, but if you have like a spot, you can show them. Most of the time a family doctor would still want you to see a dermatologist. But, yeah. So that's like the bread and butter of preventative care, is go get your annual physical every year, and that is covered by insurance. Additionally, if you're female, you will probably see an OB-GYN. And this would be for a pelvic exam at least once, just for them to look at the area, make sure the anatomy is normal. Sometimes they will use a speculum to go into the vagina, make sure the vaginal canal looks normal, the cervix looks normal. If you're having any concerns for that area, they'll be able to look there. If they need to do a pap smear, which is just where they take a scraping of the cervical tissue, they can do that during that exam. They'll ask you about your menstrual cycles and making sure that they're regular, seeing if you're having any abnormal bleeding or pain. They might ask you about your breast health, your sexual health, fertility planning. If you're premenopausal or menopausal, they'll ask you about that, which is usually more in like the mid 40s to 50s. And then around that time too, they'll talk to you about hormone replacement therapy. So the purpose is to ensure good health specifically for females.
And that should be how often?
It kind of depends on what guideline you're looking at, but most commonly it's recommended to see them annually for just a check-in. They can do a pelvic exam, make sure everything's going well with, like I said, menstruation, sexual health, breast health. And also at that visit, if you are sexually active and you're at risk for STIs, which is people specifically under 25 who have like multiple sexual partners over the course of a few years, they can screen for sexually transmitted infections. So it'd be chlamydia, gonorrhea, syphilis, herpes, hepatitis B or C, HIV. They can check all of that there. And then if you get pregnant or if you're fertility planning, you'll go see them way more frequently. And that's like its own schedule. It used to be recommended to be doing monthly self breast exams to make sure you don't have any abnormal lumps. That's not recommended anymore. Now it's just recommended to have like general breast awareness. So know what your breasts feel like and look like, and just maybe like here and there if you're in the shower or if you're looking in the mirror, just notice like, does something feel weird, look weird? And then you could go see your OB-GYN for that as well. All right, skin health. So for this one, you're going to see the dermatologist. This is an annual full body skin check. So once a year, you see them. They look head to toe. They should be looking in all the crevices, including your privates, your feet, your toes, your mouth, your armpits. They should be looking everywhere. they're screening for cancer. So melanomas, basal cells, squamous cells, things that could turn into cancer. And then you see them more frequently if you have like cosmetic concerns or if you have a spot that's concerning you, acne, whatever. This is to prevent and diagnose and treat skin cancer and other skin conditions. Eye health, so this would be an ophthalmologist would be who you're seeing. They'll do a vision screening and testing to prevent and diagnose and treat any vision problems. Most people don't see an eye doctor unless they have to, but it is recommended to go once if you have no issues, just to make sure your vision's good, because maybe you don't know and you've just gotten used to it. And then if you have problems, you can go every 1 to 2 years. Like if you're at risk for developing vision issues, you can go more frequently, and then typically like every 2 to 4 years after age 40. For hearing, you go see an otologist. Why can't I think of that?
Audiologist?
Or audiologist either. This is a hearing screening. So this is your hearing is screened at birth, and then usually like every 10 years until you're 50, and then every 3 years after that. More if it's needed if you're having hearing issues.
And they do a basic hearing exam for school yearly.
Oh, good to know.
Or maybe that's only if you have an individualized education plan.
Okay.
The school likely has some kind of a...
And teachers would be picking up on it too if your kid had some hearing issues,
Mm-hmm.
hopefully. For mouth health, you'll go see your dentist, everyone's favorite. Just kidding. At this exam, this is every 6 months is how often you should be doing it. More if you have issues, but 6 months for a general preventative health checkup. This includes an x-ray of your teeth to make sure there's no cavities or other abnormal anatomical things, an exam by the dentist themselves, and then a cleaning by the dental hygienist. Very important. I always put off the dentist, and they always tell me I should be coming more often. So this is to prevent dental caries, which are cavities, or periodontal disease, which is inflammation of the gums around the teeth. Very important. For bone health, this doesn't typically become an issue until a little later in life, but this will be a test ordered by your primary care doctor. And then if there's issues, you could see like an endocrinologist. But this would be called a DEXA scan. So it's a bone density scan. It's an x-ray. It looks at your hips and your lumbar spine, your low spine, and it shows you like how mineralized the bone is. And then your provider uses a FRAX score, FRAX, to basically give you a number for how at risk you are for a future fracture if you were to fall, or even just like a compression fracture from like not even falling. So the purpose is to prevent fractures, because the older you get, the more at risk you are for osteopenia, is like softening of the bone, and then it can get worse into osteoporosis, which is when the bone mineral density is very low. So you get this ordered once at age 65 or earlier if you have risk factors, and then you'll do surveillance. So if you're low risk, it's every 5 to 10 years from there. If you have osteopenia, it's every 2 to 5 years. And then if you have osteoporosis, it's every 1 to 2 years. Okay, immunizations or vaccinations. So this would be by your primary care doctor. You could talk about it during your annual physical, or you could go to like urgent care. You know, vaccines start in childhood and then they go through adulthood, and then you have some that don't occur until you're older. But look into your vaccines and make sure you know what's in them and make sure you agree with it. But generally in the medical community, it's advised to get immunized against these diseases because they can cause complications and issues. So the CDC has like a full schedule of what you should be getting, but for like around our age, typically the CDC recommends like influenza annually, a Tdap, which is tetanus, diphtheria, pertussis every 10 years, or it's actually given every time you're pregnant, which is kind of crazy, but it is. And then HPV, you typically will get 3 doses of that by the time you're 26. Sometimes they extend that. That's to prevent some of the HPV viruses that can cause cervical cancer. And then Shingrix, or it's against shingles. That's when you're 50. And then when you're 65, you get the pneumococcal to fight against certain bacteria that causes pneumonia. Okay, for cancer screening specifically, this will all be from your primary care doctor, but it's helpful to know the breakdown of when you should be doing these things. So cervical cancer screening, this is what a pap smear is for. So again, they do a pelvic exam. They use the speculum, which is just like a little beaker looking thing that opens up the vaginal canal. They use a tiny little like wand to scrape the cervical canal. to get those cells and make sure they're not abnormal. That is every 3 years if you're between 21 and 29. And then you can switch to every 5 years from 30 to 65 and do a pap smear, which with also HIV testing. And typically you can stop age 65, or if you don't have any history of abnormal findings, you can stop then. But if you're at risk for like different partners or things, you can continue it. Colon cancer. Colon cancer is unfortunately becoming so common. So you start getting a colonoscopy. That's where you have some sort of sedation, and then they use a very small tube. They go in through the anus, the booty hole, and they go up through the colon, and they look for any concerning findings of the wall. That starts at age 45.
What?
Yeah, early. 45. If you have a family member who has been diagnosed with colon cancer, you actually start 10 years earlier than the age that they were diagnosed. So if they were diagnosed at 46, you would start at 36.
Wow.
Yeah. Which is good.
What is it called when they like flush you out? I thought that was a colonoscopy.
A prep. That's the prep for the colonoscopy.
Okay.
Yeah, so they're just getting...
So they can have visualization.
Yes,
Okay.
they're just getting all the poop out. Some people can do a Cologuard test or like FIT testing, which is where you send in a fecal sample. It's not at, like if it comes back abnormal, they'll still have to do a colonoscopy. But if you're like, I absolutely won't do a colonoscopy, then you could start
Honestly,
there.
sounds kind of nice. Not gonna lie, just
Doing
a
a
little
FIT.
flush.
Oh, I know. I agree. I
flush.
kind of like want to do it. For breast cancer, you do a mammogram every other year, starting at age 40.
Oh, okay.
Or earlier if you're at risk, like if you have a family member that was diagnosed, or if you have the BRCA gene or something like that, until you're age 75 typically. Okay. Standard for a mammogram is going to be a 2D x-ray. So it takes here, 2 angles. Or now a lot of people are getting the DBT. It's a 3D mammogram, and it has like a bunch of different angles, and it can visualize lesions better. And then there's actually a lower false positive rate with that because it can see the areas better. And then sometimes people get like an ultrasound or an MRI if they have really dense breasts or if they need to look further into something. So that's the general screenings from a medicine and preventative health perspective. I also really think it's important to think about wellness, which is a bigger, like more broad topic, and think about some things for that. So like I said, at your annual physical, you'll get a general lab screening, but they won't do like all of the metabolic markers. They won't look at
Hormones.
They won't as much. Sometimes your OB will look some more into that if you're having issues, or markers of certain nutrients. They won't look at like all of the thyroid markers. And so I really think, this is just like my opinion. This is not from this isn't like medical advice. Obviously, none of this is, but you can go to a functional lab provider and they can order a whole slew of tests. Some people think it's just an extra cost and it's unnecessary, and potentially it could be ringing the alarm on something that's not actually worrisome. But in my opinion, I want the information. Like I want to know all the details of how my body's doing and then figure out what to do from there. Maybe it's nothing. So there's a lot of different ones now. I actually just signed up for Function Health, which they do like, I think it's 180 labs. So it's a lot. I was supposed to get it this morning, but the babysitter canceled.
No.
So I'm doing that soon. And so I would at least say like once in your adulthood, do a bigger kind of functional lab panel. And if you have something that comes up abnormal, maybe you can follow up on that. I also think it's helpful if you have not done a lot of research on nutrition and how food can be used as medicine and how food is so dang important for our health.
Like a supplement, or instead of taking all these other things.
And just truly food. Yeah, like what vitamins and minerals and proteins and what are you eating? Variety is so important. So maybe talking to, again, a functional provider or dietitians, it depends. You need to see kind of where their mindset is, because a lot of dietitians are trained like very medically, where they're more focused on like you need this many grams of the macronutrients, and they maybe won't be as helpful for helping you optimize your nutrition, but hopefully they will. So find
or
a
like
good one.
in seasons of sickness or in seasons of blank, eat more of this.
Yeah,
things like that.
Yeah, exactly. There's some providers now that will do biometrics. So this will show you like your body composition and looking further into how you're doing from like a fitness perspective, your VO2 max, stuff like that. If you're interested in that, you can see a sleep doctor if you have concerns about your sleep. They can rule out sleep apnea or a lot of different things. That's very important. Obviously, we know sleep is so important for our health. And then if you're having issues or if you're not, I think counseling and therapy is so helpful just for, I don't know, having a better relationship with yourself and other people, getting the most out of life. So that would be my recommendations from like a more wellness perspective. Everything. It's like kind of a lot.
Yeah. But most things are annual. The only thing that's more frequent than that is the dentist. It's 6 months.
And then problem visits, like if you have other stuff. Yeah.
Okay.
So that's it. So Eden,
I can do that.
Eden,
I gotta
your
find a
freaking labs
PCP
drawn
first.
I'll help you
And then I'll get my labs drawn.
at that visit.
And then I'm going to go to the dermatologist. Okay.
It's not that bad.
Okay.
And then maybe go to OB-GYN.
Okay.
I mean, have you had a PAP? You have.
It's been 4 years.
Good.
5 years.
Yes. I mean, technically every 3 years you should.
Okay.
So it's time. Anyway, for anyone else listening, it's probably time for you too. So this is a good reminder.
It's really helpful to know, just to like, to me, I get stressed about my health, but I don't take action. So it's good to know what like the standard is and to try to do that, to just not worry that you're missing something.
Exactly.
To know that you're doing what you need to do and you're not, I don't know. I think it could lead to less health anxiety, but for some reason it feels hard to get started.
Yeah, no, it is. I mean, it's a lot of time and effort, but I think it's worth it to know how you're doing, especially the labs.
Yeah.
So,
Okay, gotta go get my labs.
okay, bye.
Bye.